Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Hello and good morning, everyone. Hope we're all having a lovely weekend so far. My name is Tayo. I'm a hospital-based pharmacist, and I'm excited to be your host for this session. Thank you so much for joining us from wherever you're joining us from. If it's your very first time, a warm welcome to you. So this webinar is just about bringing key health topics to the Black community, and it's featuring expert, like you saw in the video, pharmacists, doctors, nurses, just from around the world. So today's session is a really good session. We'll be focusing on stroke, specifically what happens when the doctor becomes the patient. And today our speaker is Dr. Ayo Olatoye. He's a consultant in acute medicine based in Greater Manchester. He's not only an experienced clinician, but he's also a transformational mindset coach specializing in burnout and sleep health. Beyond his clinical work, he's also the author of Building Blocks, a keynote speaker and podcaster, and also a husband and a father. So he's got a lot of knowledge and wealth to bring today to today's session. And you can also see, I guess, like when the clinician becomes the patient. You can also find him on his LinkedIn, his name, which is Dr. Ayo Olatoye. So I encourage everyone to please stay engaged. If you have any questions, just pop them in the chat after Dr. Ayo speaks, and then we can just answer them as and when. So without further ado, I'll just hand it over to Dr. Ayo.
Thank you very much, Tayo. Thank you. It's an honor to be talking to you on the CAHN Health Hour again. I want to give CAHN its props. The work that you're doing in the community is really, really important. So thank you. And thank you for this special session. So normally we're the experts talking from a health point of view, talking to people and giving our perspective on how they can make their life healthier. And this is a slightly different thing, talking about what it's like on the other side. So as Tayo said, I'm many things. So I am a Christian, a husband, a father. I'm your brother, or your uncle. Now I'm getting a bit older. I am a mindset coach. I'm an author. As a hobby, I'm a consultant in acute medicine, and I'm a stroke survivor. So this session, I'm just going to essentially talk to you about what it's like having a stroke, what happened, what the issues surrounding it are and were for me. And hopefully there's some value that you can get from the conversation. So, I mean, if you have anybody who was thinking about this call and they haven't logged on yet, maybe send a message to people and say, it's about to start, it's about to get good. So for the next maybe half an hour, 40 minutes, I'm going to talk to you about my experience, and I'm going to leave some time for questions at the end. So let's start at the beginning. I was a consultant in acute medicine. The hospital that I was working at, there was a day in June of 2020, yes, during the COVID pandemic. I was at work, And I remember one of the things that I do at work is because of my job, I'm doing a ward round every morning. So a ward round is where I have a list of patients that I have to see and try and figure out what I think is wrong with them and figure out a plan to either make them better or, they can be discharged or sent to another specialty. So I was doing the ward round and I just felt non-specifically unwell. I had been trying to do some intermittent fasting at the time. So I thought, well, is it that? Because often when you change your health behaviors, sometimes you can have blips and symptoms and feel better and feel worse. I thought, is it that? I asked a nurse to check my blood sugar and it was 5.6 or something. That was normal. So I was okay. But I still ate a biscuit because I was like, I'm not sure. And then I just felt, again, non-specifically unwell, but I powered through because that's what you're supposed to do. And I just kept going through the ward round. I remember being aware of during the ward round, I kept doing this. I had some discomfort in my shoulder. And by the end of the ward round, I suppose I was limping ever so slightly. And I've had migraines in the past, and there is a kind of migraine you can get which can give you funny symptoms and stroke-like symptoms. So in my mind, I was like, well, it's probably just a migraine. Let me just carry on and let me just power through, power through. And I finished the ward and I didn't feel better. And for some reason, I asked one of the nurses to check my blood pressure. My blood pressure was very, very high, like 170 over, I don't know, 100 or something like that. And I remember thinking, it's interesting because I normally don't have any issues with my blood pressure, as far as I could tell. I hadn't checked my blood pressure for probably 5 years prior to this. So I remember thinking, I was on a half day. So after the ward round, I handed over every patient I'd seen and I left. I drove home. I think probably for a millisecond, I probably thought, I'm having a stroke. Not longer than that, drove home. Again, just feeling non-specifically unwell. I remember I was due to take my car for a service. So I drove to the garage and my wife met me at the garage and they were like, oh no, we can do the car, we can do it in 30 minutes, 40 minutes. So you might as well just wait rather than go home and come back. So my wife went and I stayed in the garage. I think I fell asleep, or at least I was just tired. I got home, didn't feel much better. I ate something, didn't feel better. I had a nap, didn't feel better. This is now hours and hours after the war run in the morning. And I think this is probably between 9 and 10 p.m. And we have a blood pressure monitor at home. And I checked my blood pressure. It was high, 210 over 120, 140. And by this stage, I was limping quite heavily. And I don't know whether you've ever banged your funny bone. So, when you bang your funny bone, you get this feeling of pins and needles that are squeezing. I had that from the top of my head on my left side to my feet on my left side. So the whole of my left side had that pins and needles and squeezing. And at the stage, I was like, well, rather than thinking, oh, I should probably go to the hospital, my actual thought was, I've done everything I can not to avoid going to the hospital, and I'm still not better. So I guess I have to go. It was very, very reluctant. So this was around 11-ish p.m. We called my mum to come and stay with the kids, and my wife drove me to the hospital. And this was, again, during the COVID pandemic. So my wife couldn't come in with me. And so she dropped me off at the triage because I changed it at the hospital that I was at. And the triage nurse just came to meet me. My wife tells me she was very upset with her because I was limping and she didn't help me. At least this is my wife's perception. While I walked, into the hospital. And there are tests that we do as doctors to try and figure out, is there a problem happening in the brain? So I'll give you an example of it. So one of the tests that we do is to check for strength in the arms. Your body it's not just consciously moving your arms when you tell it to. but there are systems in your body that help you understand where you are in space. So when you put your arms up like that, your body knows both my arms are raised and they're at the same level. But when you have a stroke, one thing that can happen is the body's able to, it's called propriocept, figure out where you are in space, becomes affected. So often when people have strokes and they close their eyes, one of the arms can move, but the body isn't aware of it. So I did this test, and my arm was here, and it was a surprise because I didn't feel it move. And I started to think, oh, okay, this is an issue. And then I had a CT scan of my head. And CT scan of my head, it looked fine, but obviously I still had these symptoms. And they kept telling me your blood pressure is high as well. So because I had the symptoms, I was transferred to a specialist stroke hospital, so in Manchester, that is Salford. And I went to Salford. I was on the stroke ward, and then I got seen by a consultant in the day. And then she was like, no, I think you need to have an MRI scan. So the difference between an MRI and a CT scan is that in the context of stroke, an MRI is a more detailed scan that helps us differentiate between different soft tissues. MRIs are great for some things and CTs are better for some things. But in the context of stroke, an MRI is a better scan. So we did an MRI scan and I had a small stroke on the right side of my brain, which explained the symptoms on the left side of my brain. And then they said, okay, you've also got high blood pressure. And they started me on some medication. So this is now the day after, probably longer than 24 hours after my symptoms started. So at the time, I was 39 and I'd had a stroke. So that's the abridged version. Now, what happened afterwards? So again, this is during the COVID pandemic. So we were doing everything we can to get people out of the hospital at a rate probably different to usual. And I was able to walk, I was able to talk, I was able to think, and all these things were tested. So the next day they were like, okay, you can go home. And my wife came and picked me up, and then I came home. And yeah, it was interesting because again, I was 39 and I would have considered myself fit. In fact, for a few months before, I was doing regular high intensity interval training. And there were some investigations that needed to happen because I was a young person. And why did I have a stroke and why did I have high blood pressure? So we did some scans of my heart, looked at the blood vessels in my neck. We did a 24-hour tape. All of these things are looking at, well, why did this guy have a stroke? Because again, I was young, I was slim, and I'm not. You would have looked at me and be like, this guy, but why did he have a stroke? So that's one of the things that we do as doctors. When somebody has a stroke, we try to look for why. Because if there is something that we can find out that is a cause, we might be able to modify that, and that reduces the stroke or risk of stroke for next time. So, but yeah, I was 39 and I had to wrestle with the fact that I've had a stroke. Now, I know some things about stroke. Things like, so we're used to thinking about things like the cardiovascular system. So let's break those words down. Cardio, heart, vascular, blood vessel system. Now, in general, when you have a problem with a blood vessel in one place, it indicates you have a problem with blood vessels everywhere. So one of the things I know is that people who have strokes as a consequence of blockages are at increased risk of things like heart attacks. I'm 39, so I'm not. And immediately after I have a stroke and get diagnosed with high blood pressure, when it comes to risk assessment at work, I'm in the high risk bracket. And at the time, there was all this data about people in high risk brackets dying more frequently from COVID. So I mean, am I going to be able to go back to work? All of these things I'm thinking. I'm 39. And I'm thinking about the fact that I'm a locum, that means I'm a contractor. So I'm off because I have to recover. But every day that I'm not at work, I'm thinking about the financial implications of not being at work. And it was surprising how close we came to, the end of our resources because I wasn't at work for 6 weeks. There's somebody who's a financial planner, and he said that most people are 2 mortgage payments away from homelessness. And not that we were there, but it was surprising how close we came to it being a struggle. And again, I'm thinking about all of that. I'm thinking about I'm a Christian. Am I not supposed to be protected from these things? God, what are you doing? Why? Why did I have a stroke? All of these things I'm thinking. And I'm going to come back to these questions, at the end. But for the sake of making sure that everybody understands what we're talking about, I'm going to talk to you about a few things. So the first thing is, what is a stroke? So I want you to think about blood vessels like roads. So you've got motorways, A roads, B roads, winding roads that end up in a cul-de-sac. So think about that in your body. Blood vessels are like roads. And at the end of the cul-de-sac, you have houses and fields and stuff. And those houses, you can think of like your organs. Those organs need something. They need energy, they need oxygen. And the cars on the road are taking the oxygen and the nutrients and all the stuff where it needs to go. Does that make sense? That's the analogy I want to give you. So what a stroke is the blood vessels in the brain, for whatever reason, the blood isn't able to get to where it needs to get to. So, essentially that part of the brain dies. That's what a stroke is. So again, in terms of a road, imagine you're on a bridge, or you're on a road, or you're on a motorway, and a lorry turns over. That traffic now can't get to where it needs to go. And if the thing that it's transporting, in this analogy, oxygen, nutrients, and energy, doesn't get there, that part of the brain dies. So that's the most common type of stroke. It's what we call an ischemic stroke. And it's as a consequence of a blockage or a clot. Does that make sense? That's the one that most people have. That's the one that I had. Now, there's another kind of stroke. So what I want you to imagine this analogy is, let's say there's been an accident on a bridge, and now all the cars that are coming, there is a hole in the bridge, and nobody can see it. So everybody is driving at full speed, but they get to a hole in the bridge and they just fall off into the river. So it still results in the organ, the tissue not getting the blood, but it's because the blood is leaking. The cars are falling off the bridge. That's called a hemorrhage or a bleed. Now, it still results in part of the brain dying, but as a consequence of a bleed rather than because of a clot. So I hope that makes sense to you. So that's what a stroke is. I mentioned before about one part of the brain affecting the other. So an important thing to know in general is that you have 2 parts of your brain, the left side and the right side. And the nerves, when they're going to supply the body, they cross over. So the right side of the brain controls the left side of the body and vice versa, which is why the problem being on my right side of my brain affected the left side of my body. Now, what are the common features of stroke? So there are things like the usual stuff. It says fast, so facial asymmetry. You can have weakness of one arm or one leg. And you have to do things very quickly because things that happen with blood vessels happen very quickly. But there can be some subtle changes. Like in my case, it wasn't obvious that I was having a stroke. I didn't have any facial weakness. All I had was this non-specific symptom of feeling unwell, a bit of weakness in my arm and my leg, and the strong feeling of pins and needles on the left side. So that's what a stroke is. Very quickly, high blood pressure, in medical term we call that hypertension, is imagine you're in a rubber tube and you're pushing against the sides. That pressure against the sides is called blood pressure in a blood vessel. The problem with high blood pressure is that if it's not controlled over time, it damages the blood vessels and it can damage the organ that the blood vessel is supplying. High blood pressure is a big issue in the Black community because of lots of different reasons. And it's called a silent killer because most people who have high blood pressure never have any symptoms. You only really have symptoms when the symptoms are very, very high. So I'm in a situation where I've been diagnosed with two things that increase what's called the cardiovascular risk, meaning that my risk of heart attack in the future, another stroke in the future, is high compared to where it was before. And I'm having to wrestle with this. I'm having to deal with this emotionally because I'm a young man. I wouldn't have considered myself unwell, and I hope by God's grace to live to my 80s and maybe 90s. So that means that another half of my life is potentially affected by the fact that I've had a problem that increases my risk in the future. High blood pressure and stuff can increase the risk of things like dementia and stuff. All these things are running through my brain. So the first things I have to do is, again, as doctors, we try to look at risk factors or modifiable risk factors. I can't help that I'm a man, I can't help that I'm Black, but there are some things that we can do. So blood pressure is one of those things. So I now have to make sure that my lifestyle is the kind of lifestyle that helps me reduce risk in the future. Now, I'm not an emotional navel gazer. I don't spend lots of time, oh, why did this happen to me? My stroke consultant said something to me that was very profound. He said, some things happen to you and some things happen for you. And I heard another phrase, if you survive your first heart attack and you make some changes, you can live to be an old man. And my faith I'm so grateful for my parents who instilled in me a faith that looked at God like he really is, as he portrays himself in the Bible, meaning that I don't believe God is a spiritual Santa Claus who just gives me everything that I want. God is king. I am in his kingdom, and I don't understand the things that he's doing. However, he's also my father. So when he says to me in the Bible, things like Jeremiah 29:11, I have plans for you. I have a good plan for you to bring you to an expected end. It's not faith if nothing bad ever happens. My faith helps me understand that bad things are going to happen. Jesus said that in this world you're going to have trouble. But take care that I've overcome the world. So I believe I am in Jesus and he is in me. So if he's an overcomer, that means I am an overcomer. And that's the mindset that I attacked it with. There were wobbles, absolutely, absolutely. But that's the mindset that I went with. I was also very conscious of the fact that some people use the concept of faith as a sedative. I have faith that I'm going to be well. I have faith that I'm going to be rich. I have faith that I'm going to get married. And they just sit down and do nothing. Well, that's not what the Bible says. The Bible says, show me your faith by doing stuff. So faith without works is dead. So very quickly, I became very astutely aware of, okay, a lot of the promises that I've heard in the Bible, some of them are conditional. What does that mean? That means that God is going to do his part. I cannot do his part, but he will not do my part. So let me give you an example. I can have an overnight vigil and pray all night for God to make my bed. But when I get up in the morning, I'm going to have to make the bed because that's my part. So when it comes to health, I believe that God wants me to, the Bible says, I wish above all that you would prosper and be in health. It's clear that that's God's disposition. But if all I do is eat McDonald's every day, or KFC, I mean, there are other fast food providers. If all I do is put things in my body that don't help me or I live a sedentary lifestyle, I'm not going to enjoy the thing that is a promise based on a condition of me doing something. So for me, faith really spoke to, okay, so what am I? So I've had a stroke. I've been diagnosed with high blood pressure. But what am I going to do? What am I going to do? Am I going to just sit here and wallow? Or am I going to make some changes in my life and partner with God? Because he wants me to be healthy, but he's not going to exercise for me. He's not going to put the muffin down. He's not going to make sure that I organize my life in such a way that I have a good night's sleep. He's not going to drink the water. I have to do all of those things. And because of, again, I'm grateful for my parents who taught me about service. That's why I started to do these kinds of presentations and have conversations with people in our communities to say, look, I've had a stroke. I've had a stroke and look at me. So if I can have a stroke and if I can get diagnosed with blood pressure, high blood pressure, then, you know, it's something for you to be wary about or to be conscious about. For me, once I got the diagnosis, if I'm honest with you, I'm very grateful now that I had the stroke because my life is different than it was before. The way that I am intentional about my health is different than it was before, about my finances, about my relationships, about my relationship with God. All of these things are different than they were before. I'm in a much better place. And again, so I don't know whether some of you are connected with me on social media. One of the things I started to do is just 5 times a week now, I'm doing some exercise. And I've been doing that consistently for almost 2 years. I would never have done that before. And who knows what the implications of that might have been, you know, in the future. This conversation I'm having with you, I don't know that I would have done that before. I don't know that I would have seen the need for it, but I'm so grateful for the journey and the impact that God has been able to give me by being invited to platforms like this to have conversations with people like you and tell you about my experience. So after the stroke and when I got back to work, I decided to be very intentional about my life because, you know, I wasn't expecting them. There were some things that really made me think about where I was, and I started having conversations with people in our community. So the first thing is that I have stroke and high blood pressure in my family. And they say, you know, doctors are the worst patients. I've been going to work. I've been dealing with people with high blood pressure almost on a daily basis. I'd never checked my own blood pressure, probably for 5 years prior. So that had to change. And I started just encouraging people, if you're in your 30s and you're Black or you have a family history of high blood pressure, you should just check. You should just check. One of the things that we know about Black people is that our health-seeking behaviors sometimes isn't so good. So we're not forward in engaging with healthcare. I know that in some places there's an issue with trust, which is why I'm so grateful for CAHN creating platforms like this, because it's people who look like us telling us about what the best way to take care of our health. I also became very conscious about taking responsibility for my life. I know for a lot of people, even people that I meet at work, they don't want to take responsibility for their health. And this has many implications. So I believe that I am a body, soul, and spirit. And as a Christian, there's lots of conversation I'm having about my spirit. But I believe the church needs to work at having more conversations about body and soul. And one of the things that I think happened, you know, historically is that people, because we believe God is good, or because we believe God heals, or God is going to bless, what we did, especially in the Christian community, is that we abdicated what was our responsibility. So I can eat whatever I like because God will heal. I know God can heal. I can eat whatever I like. I'm going to do that. I can not exercise. I can live sedentary. I know, or I'm not going to budget. I'm not going to do any savings. I'm not going to invest because God's going to bless me. That to me is a misinterpretation of Scripture, because God is in partnership with me in so many things. And what he wants me to do is to do my part. So after the stroke, one of the big things I started to do with my life is take responsibility about the areas in my life that I could do and encourage other people to do the same. So while I run this call, when was the last time you checked your blood pressure? Uncle, auntie, brother, sister, I made a list of the things in my life that were like, so these are the areas of my relationship with God, my relationship with my wife, kids, family, my finances, my health. And I made a promise to myself to be intentional about affecting these areas. Okay, so my finances need to be better. How am I going to do that? I'm going to take responsibility for that. I am where I am because of the choices that I've made. Okay, my health, I need it to be better. So what do I need to, because the great thing about medicine, modern medicine, is that it's absolutely fantastic for an emergency. I'm so grateful for the doctors and the nurses who helped me during the stroke. Now, one of the things that is becoming clear in our studies is that a lot of the things that we do in an emergency aren't necessarily the absolute best things to do for maintenance. So as a doctor, I now have to say, okay, let's use all the knowledge that I have. Definitely, I'm going to take medication. I'm still on that medication. However, I am also going to do other things because the medication is probably a fraction of all the changes that I can make so that I have longevity. Because now what's the goal? The goal isn't just to get to 50, 60, 70. I want to get to 80 and I want to get there strong. I want to be like Caleb. The Bible says that he looked at a mountain 40 years after God promised to him and said, I'm as strong now as I was today. Some of us read that and we think, oh, that's a blessing. And I'm reading that and thinking, okay, so what did Caleb do? He must have been active. He must have kept going. Because I don't want to over spiritualize it. His physical body was strong because he kept his physical body strong. And now there's lots of data to say that things like weight training, it helps us with longevity in a way that we hadn't understood before. So yes, run, yes, skip, but specifically weight training helps you from a longevity point of view, and actually exercise is one of the only things that keeps you cognitively strong when you're older. So that's kind of a whistle-stop tour of my journey from being diagnosed with having a stroke, being diagnosed with having a blood pressure, high blood pressure rather, the immediate aftermath of it in terms of the practical applications, so the investigations into the why, and the emotional toll that it took on me as a human being, a young person, a young Black doctor who was diagnosed with blood pressure, high blood pressure and stroke, and having to modify my life so that I can live the next 40 years of my life, 50 years of my life in good health. There's lots of other things that I can say, but I wanted to open this up for questions before I talk about anything else. So maybe I'll put a pin in there, Tayo, if you have any questions.
Hello, thank you so much for, hello? Can you hear me? Yeah, hi. And thank you so much for that short presentation and the short personal. Oh. Sorry, for the short personal presentation regarding, from when you had the stroke all the way to the recovery and all the way to the thoughts. Obviously, you infused your faith with it as well, because I think when people have these journeys, they become very downcast. They're like how you said in the beginning, that why did God do this to me? You're like a fit. You're in your 30s, late 30s actually, which is actually very surprising to have stroke when you have no other comorbidities. But thankfully it was diagnosed. Thankfully you're here today with your family and you're able to speak about your journey and also speak about it with people in the church. So we've just had some questions in the chat. But before I do go to the questions, I want to quickly just reiterate what Natasha put about the blood pressure checks. Do check your blood pressure if you do. They're very easy to get. You can go to your local pharmacy as well to get them done. My mom gets them done because she's got hypertension as well, because that runs in our family. It's very easy, very quickly to do. And there's also an event as well, Africa Day 2025. Thursday, the 22nd of May, 10 to 3, which you can also get your health screening there as well. And if you're invited to a health screening session as well, do go for them. They're very, very, very useful. So I'll just
Can I just piggyback on that as well? So I think one of the things that in the conversations I've had with people, I've noticed is that for some people, there are two reactions to something like this, either the illness or the prospect of an illness. One group of people, we bury our heads in the sand. I don't want to know, I don't want to know, I don't want to know, I don't want to know. And some people, we face it head on. My concern is that if you bury your head in the sand, it doesn't stop it affecting you. And there is a conversation to be had about, okay, well, the fear of, okay, what if I find something? As a doctor and as your brother, I would say it's always better to know than not to know. So when you hear about things, don't just rubbish it and wait for somebody else. No, it's for you. Please, please, please engage with these things and go when you're invited.
definitely. Thank you very much. So the first question is, Dr. Ayo, did being a doctor make you take your own symptoms more seriously, or did you downplay them too?
I think probably the latter. I downplay them. So yeah, I think it's not just being a doctor. So it's being a doctor, it's being a man, it's being black. So all of these groups of people in general don't necessarily take their own symptoms very well. So again, doctors are notoriously famous for not taking their own health very seriously. And I think that was just like, and to be fair, it was a pretty atypical presentation because it was just, pins and needles. I think it might be slightly different if, let's say, there was facial weakness or whole body weakness. So I think I did probably downplay it in my own mind. And as a man, often we're in situations, and there's a balance because you can also go to the other extreme and be like a hypochondriac, and every single thing you're in hospital asking somebody, about this, and I've met those patients. So I think there is a balance. However, I think all those things that I am probably contributed to me just be like, oh, I'll be fine. Be fine. And I'm, again, one of the reasons why I'm grateful to God is because the stroke was small. I didn't have significant deficits. There's people who die from strokes. They don't recover ever, So I'm not poo-pooing it. I do take it very, very seriously. Something I forgot to say is that I still have symptoms. So especially when I'm tired, I still have some of those symptoms. So it's not like there are some people who have a stroke and they have 100% complete recovery. That's not been my story. I still have symptoms. And I'm still grateful. I'm still very, very, very grateful.
Thank you. I guess like a follow-on question someone asked would be, but how do we know when it's just stress versus something serious like a stroke? Because you touched about how like you don't want to downplay it, but you also don't want to be like over alert about every little thing.
Yeah, this is a great question. So one of the things I find when I see people at work in that they come in and they have symptoms, and as my job as a doctor is to first look for what we call the organic cause. So do I need to do a scan? Do I need to do an ECG? Do I need to all that kind of stuff? Because I'm looking for an organic cause, meaning that I find something structurally wrong or wrong with your blood tests to explain your symptoms. Now, stress is what we call a diagnosis of exclusion, meaning that I can't say it's stress till I have legitimately excluded other things. Because stress can manifest as lots of different things, but from a safety point of view, as a doctor, I need to make sure, is it something that's more legitimate first? Now, as a patient, all I would say to you is that if you have symptoms, just get them checked out. Now, if the doctor says to you that it's stress, or there's tests that have been done and it comes back that after those tests, okay, these things are negative, therefore I think the diagnosis is stress, that should help you think about what happens if those symptoms happen next time. But I think that it's always better in the moment to get checked out than not to get checked out. Now, another thing that I experience when I see patients is that when we have conversations about it, they might say, oh, I'm stressed about this, or I'm stressed about that, and I'm stressed about this, not realizing that there are lots of branches, but they're not addressing the root. The root is stress or anxiety. And I'm often saying to patients that, life can be stressful, and there are always going to be stressors. So yes, you said you're stressed about finances, or you're stressed about your mother, or you're stressed about this and that. I think that maybe something that we can look at, and you might want to have a conversation with your GP about this, is how you're coping with the stress. Because there are always going to be things that you can get stressed about. Mm-hmm. So rather than point to the thing and say, I'm stressed about that, if we address intentionally how I cope with stress in general, then whatever comes into my life, I'm now in a situation where I'm able to cope with it differently, and maybe then the manifestation of the symptoms I've just had won't happen again. I hope that makes sense.
Yeah, that makes sense. I just wanted to touch upon the point that if you do feel something is wrong, it's better to, I guess, get it checked out.
Yes,
That
exactly.
even it, because if you had left it, it would have been a completely different situation at the point. I guess another question, and this one I'm actually interested in because I work in hospital. Did hospital staff treat you differently because you're a doctor? Because you touched upon how your wife was not the happiest when I think she picked you off at A&E with the
Yeah.
nurses. Did you get any, I guess, preferential treatment or?
So I am the kind of person, I don't go around, with my lanyard when I'm a patient. I'm a doctor at work, and when I'm talking to people like you guys at CAHN, I don't. It's not my identity. It's a thing that I do. Um, I, I think that. So I do what is that when I'm unwell, if I'm ever in hospital or a GP, I don't go around saying, "Oh yeah, I'm a doctor. I want you to know I'm a doctor." I'm not hinting at that. And if it's not on my records, they may not know. I tend to keep it in my back pocket. Unless they ask me what I do, they don't know. Because sometimes what I've noticed is that as healthcare professionals, we're all human. And sometimes the fact that somebody's doctor affects decision making, it can make them stressed, and then there's decisions that they're making that they're not necessarily they wouldn't have made if they weren't stressed. So it's different people have different experiences. If you think that what happened is that I had the VIP treatment and they were feeding me grapes and I had the red cat, there was none of that. There was none of that there. But yeah, personally, I don't go around talking about me working as a doctor if I'm ever unwell. If they ask me, I'll say it, but it's not something I feel the need to, because I think sometimes and I've seen it in my colleagues, it can cause an unnecessary amount of stress. Now, it doesn't bother me as a doctor if I see other doctors, but for some people, it's a big issue.
Yeah, they do say like healthcare professionals are the hardest people to treat because you're already what's going on and you're not listening and stuff. But thank you for that. And what's the hardest part of recovery? I guess people don't talk about. You touched about how your finances were obviously a bit affected with 6 weeks without going for work. Going because you were a contractor, so obviously if you don't come to work, you don't get paid, and you have like your wife, your kids, other financial burdens that you have as well. How was that whole process?
So recovery. So after a stroke, people can still be recovering for up to a year's time. So I think the thing about when you have a stroke, if you ever have a stroke, God forbid, is to give yourself time and grace. One of the most common symptoms after a stroke, as well as whatever weaknesses you might have in terms of your muscles, is tiredness. Your brain is working overtime trying to relearn some of the things that you already knew. So there's lots of effort being put into that. So lots of people after stroke just get tired, and I found myself sleeping a lot. So that was an issue. Then there was the emotional unpacking of, wow, I've had a stroke. I've had a stroke and I'm 39. Okay. What does that mean? What does it look like in the future? And again, I can, for me, I'm grateful that I have a wonderful wife and a wonderful family. And I'm grateful for my upbringing and understanding of the character of God. So because of that mature understanding of it, I remember things like going through the Valley of Baca, or going through the Valley of the Shadow of Death. The Bible is full of conversation about there are going to be challenges, and the aim of it is to go through them, not to park in the middle of it. So I'm a very much, okay, what's next person anyway. So I was very, okay, so this has happened to me. I had to answer the question for myself, what does that mean emotionally? And again, I had to address the fear of, what does that mean I'm going to develop dementia? Does that mean I'm going to have a heart attack? Does that mean I'm going to have another stroke? I had to address the fear intentionally and articulate it to my wife, and and really talk through it, because it was really there. And I think when you have difficult emotions, not acknowledging them doesn't help you.
Yeah.
Burying them doesn't help you. So really acknowledging and coming to terms with it and facing it is the only way to get through. And then there was the taking responsibility for the rest of my life. I mean, there were other things when I'd been a consultant for some time. We bought a house, and I became aware of the fact that, there were certain areas of my life that I was coasting. You wake up on Monday, get to Friday, weekend, back to Monday, and almost every week looked the same. And I think that the reason I'm grateful for the stroke is it really shook me to be like, okay, you're 39 and 40, you're going to live by God's grace to 80. What's the rest of your life going to look like? And it forced me to answer some of these hard questions. And I think it's good for these kinds of conversations to happen, because I don't want anybody listening to have to go through a potential life-threatening illness to force you to answer these questions that are good to answer. What kind of person do you want to be? What do you want your life to be about? What do you want your legacy to be about? What do you want the people who love you to think about you? What do you want people to say about you at your deathbed? All of these things I'm now forced to think about because I had a stroke. So I'm grateful for that. In terms of physical recovery, so because of COVID, I did Zoom physio. So I had my laptop and they watched me walk and things. And I think once or twice they came to the house, but it was just, different than it would have been if not for COVID.
Yeah.
And yeah, I thankfully had my ability to think. So I spent a lot of time studying initially about finances, because I want to make sure that my family are taken care of, and I really dove into personal development in a way that I'd never done before.
Thank you so much for that. Someone just asked, what is the possibility of a young person under 25 experiencing a stroke? They said it's a shame that he experiences at 30 plus. How can I inform my friends to look out for these signs? I mean, it can happen obviously in anyone.
It can. So this is a really good question. So there are some things that can give you a genetic predisposition to stroke, but that's rare.
Yeah.
So a young person having a stroke is rare. However, there are increasing data that people are getting diagnosed with high blood pressure younger and younger, and having strokes younger and younger. So I think the things that you can do so the first thing is not to go around stressing about it or worrying about it, because like I said, stress can be an issue. I think knowledge is the phrase I use is forewarned is forearmed. So if you know something, then you can mitigate against it. When it comes to genetic predispositions, I'm not talking about the rare clotting disorder or anything like that. I'm talking about things like, okay, so this person might have a family history of high blood pressure, or family history of diabetes, or family history of miscarriage, therefore increased risk of clots and whatnot. I think that the phrase I heard from my friend, Dr. Kayode, it was genetics load the gun, but lifestyle fires the gun. So even on the conversations I've had with CAHN, or we've talked about other things, one of the things I really am grateful for is that a lot of us who are the healthcare professionals giving the talk, I'm putting the responsibility back in your camp. Some people want the doctor or the hospital or the healthcare system to take all the responsibility and you make no changes at all. I want to switch that and say, well, no, I think you should know your numbers. So normal blood pressure is 120/80. So do you know what your blood pressure is? When was the last time you checked? Do you know if there's illness in your family? How healthy are you? How much water do you drink? Because the world is completely different than it was 100 years ago. And one of the ways that it's different is that some of the things that we've done to help us from a convenience point of view may have and probably do have a detrimental effect on our health. One of the biggest things is things like sleep. If you have poor sleep, sleep increases your blood pressure and your BMI and risk of cardiovascular disease. So just things like just having poor sleep. And so how many of us have either intermittent or consistent poor sleep, and it's just one of those things that we don't think about it, but that increases your risk. So that's something to look into and address. Stress, anxiety, all of these things increase our cortisol levels in our blood, and cortisol is great in an emergency. You need it, cortisol, adrenaline, all those things. But if you are constantly in a state of stress, the cortisol levels just don't get better. And as a consequence, it has a detrimental effect on your body over a long period of time. And if we're not dealing with the things in our life mentally and emotionally, we put ourselves in situations where it might not be an issue today, but in 10 years' time, in 15 years' time, in 20 years' time, we might have done enough damage to then suffer a stroke or have a high blood pressure or have a heart attack. And I'm strongly advising that we take our health by the horns and say, this is my life. This is my body. What can I do to make sure that not just get to old age, but I get there and I'm well when I get there? I was talking to a friend because, again, I post on my social media some of the exercises that I do. And she was like, well, why are you doing all this? And I was like, because one day I want to walk my daughters down the aisle. And I want to be well. I want to play with my grandchildren. But the journey to being a healthy granddad starts today. It doesn't start in 10 years' time or 20 years' time when I actually have grandchildren. And so many of us in life don't want to do daily, boring, mundane things that will have a positive compound effect so that we're healthy in the future. And we don't realize that we are allowing daily negative compound things that are building up risk factors for a problem in 10 years' time.
Yes, thank you so much. And I think you answered some of the questions that were in the chat, like what are the symptoms of stroke? So like the whole numbness, weakness in the face, arms or legs, confusion, trouble speaking, difficulty, how you had like your numbness, your pins and needles, because one part of the other side of the brain. So dizziness, loss of balance, and also how do you get stroke? So you mentioned like the stress factor. I mean, the world is stressful itself, and you know, the cortisol. There's someone in the chat that mentioned how her son-in-law had a stroke at age 28 because he had a congenital heart murmur that he was unaware of. Sorry about that. And then the changes that you made in your lifestyle. So I'm guessing it was just being more fitter, exercising, diet. Because medication is a small.
I want to talk about it because one of the things I found that was a turn off when I had the stroke and was diagnosed with high blood pressure is a lot of the conversation about health and health changes. It seems very punitive. Don't do this and don't do that and da, 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 da. And I don't find that very motivational. And I think a lot of people are turned off by that. So what the first thing I did actually is I looked at my life and I was like, I'm not going to stop doing anything. The first thing I'm going to do is, okay, there's got to be something that I can do, which is a positive. Do this. So I started to make sure that I was drinking, 1.5, 2 liters of water a day. because I wanted to change the narrative in my own mind. Human beings, we are emotional. Every decision we make is because, no matter how logical you think you are, is because you want to, and you don't do things that you don't want to. So you want to create an environment that is easier for you to have long change. So therefore, I was like, okay, well, I won't change anything. I'm going to, negative rather, I'm going to add things that I think are positive. Now, I'm also a big believer in the concept of the one change rule. What that means is, let's say you say, well, I'm going to be healthy. I'm going to eat vegetables, or I'm going to go to the gym, and you just change one thing. If you do that thing consistently, often what happens is that you become more health conscious, and you make other changes that you didn't decide to make at the beginning, because you're like, okay, well, I want to be healthy. So if you change one thing and do that thing consistently, often the net effect of that over time is that you might change 2 things, 3 things, 4 things, and then you have the compound effect of making these positive changes over time. So first off for me was, let's drink more water, let's start walking, let's do some exercise. And then I was like, okay, let me think about what I'm putting in my body. Let's change what I'm eating. And different people have different ideas of what's healthy for them. There's lots of evidence. I would say do some research in reputable places, and don't think of it like a diet, because if it's a diet, psychologically, you're always thinking, when I'm going to go back to where I know. To have different results, you need to become a different person. So that means that changing what you think about food, your relationship with food. And what helped me, it might not help you, was intermittent fasting, because it broke the bondage, if you like, to food. I'm able to make a choice now. I don't want to eat that. Or if I'm going to eat something that is, let's say, high in sugar, I'm going to do that, and be intentional about it. But rather than by mistake do it every day, I might do it once a month, once a week, and mitigate the rest of my lifestyle choices so that I can do that. So the net effect is that the life I'm living now is completely different to the life I was living before, because I've become a different person mentally.
Thank you so much for that question. I think those are all the questions added that have been given to Dr. Ayo. If you have any further questions and we run out of time to answer live, she just put on the chat how to get in contact, just health@cahn.org.uk. Thank you so much, Dr. Ayo Olatoye, for your time. Hope you have a lovely weekend, and I'll be handing over to Natasha now. Thank you.
Thank you so much. That was a great session, Dr. Ayo, as always. Tayo as well, moderating the session so well, and we really appreciate your time, your knowledge. We know that you don't have much time off, so to volunteer your time is really, really invaluable to us. There was loads of comments as well on YouTube, people just mainly just saying thank you. It seems like they're learning a lot from your experience and that empathy and just being able to relate with your story, Dr. Ayo. I wanted to just share some of the CAHN updates. So I'll just be sharing my screen. Hopefully that will be successful. So as you can see, Dr. Ayo is there on our standard health hour flyer, because he has been doing this with us for quite a few years, even before me. So yeah, we thank him for that. So next week we'll be here the 3rd of May, Saturday, 11 a.m. as always. And the topic will be on aging. Aging is something that relates to all of us. Therefore, I assume that you will be sharing the session with all of your loved ones and networks, because this session certainly will relate to all. We have an upcoming session regarding family and advocacy. Is a family and advocacy session, basically, regarding workplace discrimination. Unfortunately, it is something that speaks to the audience that we serve, Caribbean and African community. Therefore, we really want to help you advocate better for yourself, know where to ask for help. So if you want to attend, there is a QR code on the screen and also a contact. And upcoming as well, we have a session on bereavement support for people that obviously have lost people that are important to them. We are here to support you. These sessions are completely free. And the upcoming one is in the 5th of May. Should you want to register, you have Rosalind's contact on the screen, rosalind@CAHN.org.uk. And you'll find support not just from a specialist, Rosalind, but also from the peer support of others. And as it was shared briefly during the session, we have Africa Day upcoming, and we are celebrating it in the University of Greater Manchester, previously known as Bolton, and is from 10 to 3, and we'll be focusing on business growth, on technology, and also on the background celebrating 80 years of the 5th Pan-African Conference that took place in the very city of Greater Manchester, where CAHN started. So we're really excited to celebrate with yourselves. Again, it's a free event because we really want to give back to yourselves. And very exciting, we have the Black Healthcare Awards in July upcoming. It is an awards ceremony, therefore people need to be nominated to receive awards. We try to make the process very fair. Therefore, the nominations are public. Anyone can really nominate. Dr. Ayo, you can nominate Tayo as well. They are examples of people that can be nominated. All you need to do is scan the QR code or access one of our social medias. It's been everywhere. We're just trying to get 5 minutes of your time for you to nominate someone and give them a lifetime of recognition. It does close tomorrow. So if you have been waiting to do it, this is the time. Last but not least, we have our maternal and family hub in Gorton. We are there every other Saturday to register, to express your interest. The email is on the screen, as well as you can contact our helpline. Come and be part of our community. We are offering, as always, culturally sensitive support to pregnant women and families, to their babies, and is a program that's been doing so well. We also open to volunteers, particularly volunteer midwives and nurses. So the contact is on the screen. Get in touch with us, and one way or the other, get involved with us. We're really looking forward to hear from you. Thank you so much for today. We look forward to seeing you next week. I'll certainly be here. Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the